Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Abnormal sexual development. Abnormal sexual development or XY karyotype. In male, XY karyotype and external genitalia will resemble the females. Androgen in XY karyotype issues or abnormal sexual development, we have three important things in XY karyotype. 1. Androgen insensitivity syndrome. Androgen insensitivity syndrome is the most common cause of male pseudohermaphroditism. Second, 5 alpha reductase deficiency. Third, congenital adrenal hyperplasia, where there is 17 beta hydroxylase deficiency or 17 beta hydroxysteroid deficiency, 3 beta hydroxysteroid deficiency. In 17 beta hydroxylase or 17 beta hydroxysteroid deficiency, there is increased blood pressure. 3 beta hydroxysteroid deficiency affects both male and female.
thank you and thank you for watching.